大家好，欢迎做客遇见 EASD 每日精粹直播间。本场访谈，我们荣幸地邀请到了来自 EASD 教育委员会主席茱莉亚·马德教授。Professor Mader, warm welcome.
Thank you so much.
Thank you. Professor, we know in diabetes management, diabetes education is very, very important. As a leader of diabetes education, what key role do you think diabetes education plays in improving patients' prognosis and their quality of life? Can you share with us? Thank you.
Sure. So I think the diabetes education is really the cornerstone of every decision we take in diabetes management, because people living with diabetes and also their families need to be very aware of what they do with their decisions. So really the most important thing is to have a good education right from the start and whenever needed throughout the diabetes career of the people. So really to accompany them through their life, to really make them fit for everyday life with their diabetes.
Thank you. Professor Mader, we know with the digital technology development, they are heavily used in diabetes management. For example, artificial intelligence, smartphone apps, CGM or insulin pumps and telemedicine. So would you please share with us your view on the perspective of the role of these digital tools in diabetes education?
Mm-hmm. So all of those tools can really improve quality of life, quality of care for all people living with diabetes. And I think the cornerstone is that both sides, like the people with diabetes, but also we as healthcare professionals are very familiar with these technologies so that we can introduce them to our people living with diabetes, that they are familiar with the technology, that we identify the best suitable technology for them. And then use various forms of training for them. So we have maybe live chats as we are doing now, live demonstrations, but also online training is really essential because people can take it in a small piece approach. They can do that whenever they have time for doing that. So all of that should be available for our people with diabetes.
Thank you. And Professor, we know education for children and adolescents with diabetes is unique because it involves multiple stakeholders. For example, the patients themselves, their family members, even their schools. So what are the main challenges in diabetes education for patients? And what innovative educational approaches or programs can better engage and support them? Can you share with us your experience?
Yeah, so you really mentioned the kind of big group of people who should be involved in making decisions for people living with diabetes. So it's not only the child or the adolescent, but also it involves the family, the parents, it involves the schools, the kindergarten. And so we need to have a step-wise program for them. So for example, of course, the parents and the children, they need to have more in-depth education than maybe the teacher needs to have. Again, here in Austria, we have a program in place where we can also go out to schools as diabetes educators to really bring the knowledge to the schools, to the teachers, to the peers in the school so that they are not wondering what that one kid is doing, like doing finger pricks, injecting insulin, so that we kind of get rid of the fear. There are also online resources that we have, again, that they can have online training. But I think one of the important pieces of knowledge that we bring into those schools and kindergartens is that we have one doctor or one nurse going there and really introducing everything to the families and to the surrounding group of school children and teachers so that they lose the fear of taking decisions.
Wow, that's excellent. Professor, we know diabetes education has made many and new developments in recent years, including novel education models, technological application, and even updates of international guidelines. So could you please highlight some important research findings or guideline recommendations in diabetes? education and what their implication for clinical practice?
So when it comes to technology, I think a lot of studies have shown that early introduction of technology is beneficial. Maybe not when it comes to the outcome of beta cell function maintenance, but more about quality of life, better decision making. And what I've seen in the past, that nurses sometimes were really afraid that they are overwhelming the person living with diabetes, so that they should do it step by step, not introducing everything immediately at the same point in time. But I think we underestimate our people, so that nowadays the guidelines also tell us we should introduce technology quite soon, that we should familiarize the people with the technology that we do have. And in the end, I think that will give us a very good outcome. So like, as it is always, the transition from clinical trials to the guideline takes some time, but I think the time is really now that we start early and hit early. And also, it's very important that our nurses and educators and doctors are familiar with the most modern technology, so that they don't delay the onset of use of such technology.
Exactly. And Professor, so looking to the future as a leader in diabetes education, what do you see the direction of diabetes education involvement? And what is your advice for the younger generation of these educators you would like to give to them?
So I think even if we have a lot of new and novel technology that is upcoming, the most important thing is that they have an ear for the patient, so that they really understand what their needs are, because they live with their diabetes 365 days a year, so that they together make a joint decision about the suitable technology, maybe reassess at a certain point in time and really listen to the person. Maybe the most advanced technology is not the best for everyone. May it be about funding, may it be about them being able to use it. But of course, it might be a progress over time that people's minds change. And I think the most important thing here is that they still keep their soul and spirit into their education and listen to the voice of the patient.
Thank you. And lastly, we really appreciate this opportunity by us, International Diabetes in Chinese, 国际糖尿病, our first official collaboration with EASD on this Meet EASD at this annual meeting. So I also know you have been working a lot with Chinese healthcare professionals in diabetes education. Would you please summarize in a few lines about the collaboration in education and what about the future plans you may have? Thank you.
Absolutely. So for EASD, that was really a novel approach, and we were very happy that we were approached by Chinese providers to have those collaborations. I think it's a huge group of people that we can have joint discussions with. So I just came back from an event in Shanghai, and we had very engaged discussions with your HCPs. And the interesting thing, it's also a learning from our side, because of course we do have Chinese population living across Europe, and potentially we learn how to better treat those people, because your obesity cut-off starts at a different cut-off point. Maybe there might be some insulin needs in the people earlier than we observe in European population. So I think with that joint collaboration, it's a lot of knowledge exchange and also a lot of exchange on individualized care. And I really appreciate that. And yeah, so I hope you're going to enjoy your EASD here in Vienna, and you can also enjoy some of Austrian hospitality.
Thank you.
Thank you again for the interview.
Thank you very much, Professor Mada, for your inspiring and informative sharing. And so like work together so we look for a better future. Thank you very, very much. So bye-bye.